morning. I am Dr. Kedar, consultant pediatrician with Lotus Hospitals in Kukatpally. Today we will be discussing about the dengue fever. Dengue fever is just a viral fever which is transmitted by mosquitoes. It is usually spread by the daytime mosquitoes. Once the virus enters into the body, it causes a lot of dynamic changes that are responsible for the complications that are usually seen in dengue. Primarily, being a viral infection, the WBC count or the leukocytes will decrease. This will lead to secondary bacterial infections in the body. This also leads to destruction of platelets. Platelets, when destroyed, causes bleeding tendency. There could be a bleeding tendency in various parts of the body like brain, heart, kidneys, etc. and also in the intestines, which can be seen as bloody motions. Platelets, when it falls below a critical level, requires medical admission. Other complications that are usually seen with dengue are fluid accumulation in the lungs, which can cause respiratory distress, and also lowering of the BP, that is called as hypotension. These cases also require admission to the hospital and appropriate management. The main management is fluid therapy, and fluid therapy is instituted according to standard WHO guidelines. Antibiotics can also be prescribed to prevent secondary bacterial infections also. Dengue is basically a hemodynamic instability causing phenomenon where BP falls, oxygen carrying capacity of the blood falls. If the platelet count is as low as below 20,000, with or without bleeding tendency, platelet transfusion is also advised. If the child is not improving even after supportive care, intravenous immunoglobulin is also advised in many scenarios. Usually, if the child is not sick and platelet counts more than 1 lakh and feeding well, properly hydrated, the child can be managed at home. For other details, please contact me.